Hello, everyone. I'm Carolyn Moor with the Healthy Widow, Healthy Woman podcast. And today we're going to be talking about navigating Social Security as a widow. What are the policies? What is it like in practice? And what is some new research? And our special guest today is David Weaver from the University of South Carolina. Hello, David.
Hi, Carolyn. Thanks for having me.
Thank you. Now, let me just give a little history about you. Last year in Kansas City, I saw you speaking on stage at the NACG, the National Alliance Grieving Children's Conference, and you were talking about children's survivors' benefits and Social Security. And I was fascinated by the conversation because, of course, I'm concerned about survivors' benefits for children. It's my story, my own personal story, having become widowed at 37 with a daughter, it's 2 and 4, but also, the transition of Social Security as they grew, as they turned 18, and now, of course, me soon entering into the Social Security system myself. You actually are a statistician and an economist, and you're basically an expert in Social Security policy, right?
Correct. So I've
Yeah,
done a lot of research on widow benefits and other survivor benefits.
yeah. I've read a lot of the papers and research papers that you've written, and I was really impressed. And I thought, "Well, we need to get you here talking to our community because it's so critical. The Social Security policy, public policies, is a livelihood for a large amount of the 11.6 million widowed women in the United States. So I'm looking forward to talking to you because I would say Social Security is one of the most confusing journeys for a widow and understanding. And also, are they getting the right kind of guidance? So I think we should just kind of start with what are the different types of Social Security benefits for widows?
Yeah, that's a good introduction because the benefit rules are complex and they've changed over time. Basically, there are three types of monthly widow benefits that are available from Social Security, and the benefit amounts based on the work and Social Security covered employment from the deceased husband.
Mhm.
The first type is, I think, the type that you probably had earlier in life when it's called a widowed mother benefit. And so this is paid typically to younger widows when they have a child in their care. The widow mother benefit can continue until the child turns 16. The widowed mother benefit is paid at a 75% rate. The child also receives a 75% rate. Another type of widow benefit is something called the disabled widow benefit. And that's for individuals who are at least age 50 and have been determined to have a disability by the Social Security Administration. And those benefits are paid at roughly a 72% rate. And then the final category, which is the biggest group of widows, are aged widows. Now, these are individuals who can file as early as age 60. The benefit rate depends on when the widow claims benefits. So if the widow claims benefits before retirement age, it's 100% benefit. Now, there's a special feature of the aged widow benefit that comes up a lot, which is that if the husband took early retirement, claimed benefits early, there's a cap or a limit on the widow's benefit. And so that provision is sometimes called the widow's limit provision, and it lowers the monthly benefit amount of some aged widows. Those are three broad categories of monthly benefits.
Right. There's always a lot of Google researching or waiting for their appointment at the Social Security. This is what we hear a lot during COVID and the pandemic. It was really hard to get answers. We heard a lot of just angst and frustration over that. So thank you for explaining the different types. And I believe as we go on it, I'm going to get some resources from you, like where do women go, what's the link for them to go and actually find out more information. But one of the things that's kind of new is the New York Senator Gillibrand. She's introducing something that's brand new. I want to talk about the survivors, uh, the surviving widow income fair treatment. They're calling it the SWIFT Act. And we're not talking about Taylor Swift. We're talking about Social Security with the US. How would that affect each type of those widow benefits?
Yeah, it's really interesting. The SWIFT legislation from Senator Gillibrand is kind of interesting because it would change all of those types of benefits. It would expand them in some ways. So, for example, for the widowed mother benefit, currently that benefit ends when the child turns 16. But under the SWIFT Act, the widowed mother could receive benefits until the child was either 18 or finished high school. So it would extend the period in which the benefit could be paid. And I think the logic of that is the widow is still caring for the child even when the child's 17 or 18. So it's a little bit unusual that the benefit would stop when the child's 16.
I agree.
So it would extend the period in which widowed mother benefits could be paid.
But before
With
you
regard,
start, who made that rule?
so initially, the legislation, if you go back far enough, it actually would have allowed the widowed mother to receive benefits until the child turned 18. But at some point in Social Security's history, Congress adopted legislation to only allow that benefit to be paid until the child was 16, probably as a cost-saving move or something along those lines. So Gillibrand's bill would go back to sort of the original intent and allowed the widowed mother to continue the benefit until the child's basically an adult.
Mm-hmm.
Um, the disabled widow benefit, the SWIFT Act would also change that. As I mentioned, the disabled widow benefit is paid at a 72% rate. So what that means is that when the deceased husband, Social Security looks at their earnings record and calculates what it might call a basic amount. Sometimes Social Security calls that the primary insurance amount. And then the disabled widow would get 72% of that amount. That's a little bit unusual because typically in the Social Security program, disabled individuals don't have their benefits reduced. They get the full amount. And so the SWIFT legislation would pay disabled widow benefits at the 100% rate. So it'd be an increase in the monthly benefit amount. And then the other thing that it does, which brings it in line with other Social Security disability benefits, is that you could get a disabled widow benefit at any age. Currently, you have to wait until you're age 50 to apply for it.
Yes.
And so the SWIFT Act really, in some ways, transforms disabled widow benefits in important ways. You get a full benefit, and it can be paid at any age so long as you have a disability. Then the interesting thing about the aged widow benefits, that's another benefit that the SWIFT Act touches. I mentioned that there's a special provision in the Social Security law called the widow's limit. And what happens is that if the husband takes early retirement, that is, claims benefits early, say at age 62, it establishes a cap or limit on what can be paid to the widow. That's called the widow's limit. And that affects a large number of aged widows, maybe 35 to 40%. So it affects quite a few people. The SWIFT Act would get rid of that provision. So you would there'd no longer be a cap or a limit on the widow's benefits for aged widows.
Wow.
And so one interesting thing about the SWIFT Act is it's a little bit, I think, special in some sense. It touches all the widow benefits. Legislation often doesn't take such a comprehensive view. It'll have a very narrow focus. But I do think there's something special about the bill in that all types of widow benefits have been examined and thought about and expanded under the bill.
Well, it makes me think that they've been looking at this for quite a while, because I can tell you in the 15 years that we have been Modern Widows Club, the Movement for Widow Care, these are all the many issues that we hear about from our ladies. It's one of the main reasons why I sacrificed and had disability insurance. It was my greatest fear to become disabled as the only wage earner in my household. And you know, I fully supported my daughters and our livelihood.
It is scary to think about some of the things that can happen for sure.
But it is happening. And in my case, if I did not have that, that little bit of assurance or the ability to be able to have that. And you know, what's interesting is you actually called it insurance, disability insurance, but isn't it, we pay into that system as taxpayers? So why do they call it insurance versus benefits?
Well, it's interesting. Sometimes you'll see it described as a benefit program or an insurance program. And in that sense, in its early days, it was considered and still is considered a social insurance program. So it's not private insurance, but it's social insurance. And it is supported through payroll taxes. So you're absolutely right. People, Social Security is not a means tested program. Somebody had to pay payroll taxes to support a benefit. So you're right that it's a contributory system, and it tends to be thought of insurance because it benefits are paid out when certain events occur. Somebody's disabled, they're widowed, they reach a certain age, things like that.
Correct, correct. And there's all kinds of caps as far as like what the income is, you know, of the mother. Like I never received the benefits because I went back to work, and it went back into my career. But I did get my daughter's benefits, and it was critical to our family stability. I will tell you, you know, looking back, I relied on that. Now, what I am seeing is a lot of widows when their children start turning that 16 and 18. I'm sorry, but children get more expensive as they grow into adults. Even when they turn 18, it isn't automatically like, hey, you're financially secure.
That's true, and that's a good point, Carolyn. And it used to be prior to the 1980s, the child benefit actually would continue if the child was attending college.
Correct.
And so you're right. There are
That's
expenses that occur after age 18 for sure, and they may even be higher.
yeah.
um, and so every now and then you do see legislative proposals that would allow children to continue receiving benefits even in their college years beyond 18.
I
But
thought that you would know about that, those student benefits that, by the way, I think it was like over 300,000, if I probably don't have the numbers right, students that did not get benefits. And that ended in 1999. I remember doing the research and seeing how they phased that out. And
mhm.
the question always is what did they replace it with? And I always say FAFSA. Like you get to get a loan when you can't afford to go to college, and which of course incurs more debt for families who are already probably struggling, but in order to get a higher education. I have talked to a lot of people, and probably you have too, who were a benefactor of those student benefits. And there were many adults today who said those benefits made it possible for them to get a higher education their mother would not have been able to afford, you know, to continue on in the way she did before without those benefits. Do you think that those will ever come back or some kind of alternative for that?
Well, I think they could come back in the sense that so when Congress turns to addressing broader Social Security issues, system financing, sometimes they'll review the program and bring back provisions that were thought to be helpful. You're right that when you mentioned that some people really benefited from that, there's good economic research that showed when they phase those benefits out, the college attendance of
Mhm.
surviving children dropped sharply. So it was an important benefit, not just for income support, but it definitely was tied to increased attendance in college among surviving children. And so there are a lot of people who feel like that was an important benefit, and it's unusual they phased it out. So could you see it come back? I could see something like that coming back in a broader discussion of Social Security because it has a a strong policy rationale behind it.
It does. It certainly didn't make US smarter. It
Yeah,
made
no,
it harder for grieving families, which it's already hard. So to kind of take a benefit away that was really sort of a one chance opportunity, because I can tell you, in order to overcome those benefits, I mean, we're talking 20, 30, $40,000 that a woman has to earn in income in order when she loses those, to keep a child in school, because typically they're still living at home. They're still driving vehicles that usually the parent is, participating at least in the insurance or the cost of that, or transportation in general. Healthcare is continuing. There are still so many benefits, and if I would say, if she was able to get support, just to get them through their education. And today we have so many great programs in high schools where you're getting your associate's degree, so it could even potentially only be a 2-year program.
that's
And
true.
you know what I'm saying? And so that
Yeah,
maybe there's some incentive there in order to do that in high school. There's a lot of different options. I would love to be a part of those type of conversations, because there are so many stories that we have heard here, the real stories of women who are living in those realities. And this is one of their hot topics. There's a lot of fear when women are starting to get to that 16 and 18, and most of these women are in their 50s, and
right.
and they're not going to receive benefits for probably 10, 15 years. And there, we call it hang time, which is when a widow truly is 100% responsible for, adult children who aren't quite fully sufficient on their own, but still carrying the overhead for these families.
Yeah, there's a
So,
strong case to be made for it. It helps these children transitioning to adult get a college education or a 2-year degree, but it's also true that down the road, the country benefits from that. Individuals will have higher earnings, their income will be higher in midlife. So there's a strong policy rationale for bringing the student benefit back.
there really is. And not only that, but the studies on how many more like Gen Zs are still living at home.
You're right. So Caroline, you're right. There's a little bit of a different environment now. I mean, uh, widows are caring for young people beyond age 18. You're right. So they're definitely responsible for
I'm gonna
some
raise my
pretty,
hand on one of those.
some pretty expensive things. So that's actually a really good observation about the current
Yeah.
generation for sure.
So I love talking to you about this, because really, a movement like ours wants to get behind something like this. This is good news. How do we help Senator Gillibrand's bill move forward? What can we do?
I think there are a few things. So the bill was introduced in the U.S. Senate. So Senator Gillibrand is the ranking member, or the highest ranking Democrat, on the Senate Aging Committee. So she has a platform to talk about issues related to widows. The bill currently has 4 co-sponsors, and what that means is that there are other senators who have kind of signed on saying this is a good idea. And so that's a formal process in Congress. You co-sponsor a bill. So one of the things that would definitely help would be if other senators would co-sponsor the legislation. We've talked some about how New Jersey has shown some interest in widows' issues. They have International Widow Day in New Jersey. So, for
Hmm.
example, if,
Yes.
if somebody like Senator Cory Booker, who's a prominent Democrat, would co-sponsor the bill, that would give it some attention. But in general, if individuals in the states want to encourage their senator to co-sponsor it, that's a very straightforward way to get more attention to the bill. And then the other thing I would say is typically bills get more traction if it's not just in one chamber of Congress. So it would be helpful for those who want to advance the bill to have a representative, a member of the House of Representatives, introduce a similar bill in the House of Representatives. So again, using New Jersey, I guess, as an example, there's several congressmen and women or representatives from New Jersey. So if one of those introduced the bill in the House, then you would have the bill in both chambers. So I think co-sponsors and getting the bill in both chambers of Congress are the kind of thing that build momentum for legislation. And then I would say something like getting it in the high-profile press. So, for example, if Senator Gillibrand, who's from New York, if she wrote an op-ed for the New York Times talking about the legislation, or just in general some of the issues that widows face, it would give it a prominence and kind of some momentum. So I think those are kind of some of the building blocks, I think.
Yeah, that's great. I've approached some of our widows who are in New York because I need widows from our organization, specifically from New York, to approach
Right.
her. We're going to be working on that. Some of the other, the other sponsors for that are Senator Richard Blumenthal from Connecticut.
Correct.
How do you say this? Klobuchar from
Oh,
Minnesota.
Klobuchar.
Klobuchar, thank you. Bernie Sanders from Vermont, and Patty Murray from Washington. A couple of the other people that would like to approach are Representative Julia Letlow. She's a Republican from Louisiana. She's actually widowed, so she
Hmm.
might be interested in this. And also Representative Doris Matsui. She's a Democrat from California, also widowed. And so one of the things that we're doing currently is we're researching how many widows and widowers are actually in the current Congress. And I think there's only about four of them.
Oh,
Um,
okay.
so we're kind of researching that. We also think that Senator Cory Booker, because his mother is widowed, he would have some interest in sponsoring this if he was approached. So I think that that's all. Maybe a sort of International Widows Day is coming up on June 23rd.
I
These are
see.
the types of things that we talk about. We could piggyback on getting her to do an op-ed and talking about both International Widows Day and why it's so important, because we don't have a National Widows Day in this country, and that is part of it. International Widows Day is recognized in New Jersey, and that was a 3-year process
Wow.
with Representative Gordon Johnson. And then New Jersey also has the grief bill. And so New Jersey and sort of the Northeast is positioned to sort of lead this conversation. And so I'm going to be working with you. You're going to be mentoring me on how to do this. So thank you for giving us that process. It's complex. You have to get a lot of different people involved to um, hear the real stories of women. But I'm glad it's here. I mean, this process has already started.
Yeah, it's you're right. It's you got to do a lot of work to build it. Sort of like when you're doing International Widows Day in New Jersey, like you're saying, it takes time to build support, and then you get a good outcome. So it does
That's right.
take a little bit of time to build support.
So, I'm going to love, working with you. David, I've learned so much from you over the last year. It was no mistake that we met a year ago. I follow everything. If I was you listening here, I would follow David Weaver on LinkedIn. Some of your posts are so over my head. Like there's literally, I can't even comprehend what it is that you're saying. But then some of the things that you say and you share our Modern Widows Club posts on, widows aren't voting. And this is a problem because if there's no constituency base of widows, then how are we going to approach legislators and how can we expect them to know what we need? And so, one of the things that you taught me is that the Social Security Inspector General has just released a report that is critical to how Social Security Administration handles widow benefits. What did you tell us what that report found?
Yeah, so it was kind of a little surprising that the inspector general, all agencies have inspector generals, and they're supposed to dig in and see when the agency's making mistakes. And so the inspector general recently issued a report where it found the Social Security Administration was underpaying widows. And there were a couple of reasons that happened. Like we talked about in the beginning of this, the rules are so complex. Congress has created these complex rules. It's almost hard to figure all of them out. But one of the things that was put in to help widows, particularly who were widowed early in life is a provision that Social Security calls the Windex provision, which I guess you can think of as a Windex the spray, but it's a special provision for individuals who were widowed early in life. And what it does is that when they reach older age and file for aged widow benefits, there's a special recomputation that says, well, a lot of time has passed and there's been a lot of wage growth. What we're going to do is bring up the benefit amount to reflect the sort of economic growth in the country. So it's a special provision to help individuals who are widowed early in life once they reach old age. But what happened was the Inspector General found SSA just wasn't applying it. And so the widow beneficiaries were simply underpaid. They didn't get the benefit they were due.
Wow. And how much are
and
we
who
talking?
would know about that? Like it's so funny. The program's so complicated. And people have so busy lives. I mean, it's I don't. So I actually feel like if you're applying for Social Security as an aged widow, and you were widowed earlier in life, I mean, directly ask the Social Security representative, did you include the
You're
Windex?
sort of talking about me.
It does seem to fit your case. It does fit your case. And,
mid-60s. So is this what you're about?
One of the things is it's always good to ask questions and check. And worst case scenario, you impress the Social Security representative by knowing what the Windex provision was.
Index provision like that. Right. And we need to write that down. We just need to specifically say, what is the Windex provision?
Yeah,
and does it apply to me?
The Windex provision.
I'm on the spot. I love it.
I know they'd be impressed.
They would be like, how did you know about that? Well, I'm a member of Modern Widows Club, the Movement for Widow Care, and we all know to do this now.
They would definitely pay attention to
11.6 million widows out there that this is what they need to.
The other big thing that the Inspector General found was that widows have been given special options by Congress because often they're eligible for two different types of benefits. They may be eligible for the widow benefit, but they may have worked and earned benefits on their own account, a retirement benefit. And Congress has allowed widows to separate the receipt of those benefits. So what you can do when widows reach older age, they can claim the widow benefit, but not the retirement benefit. Yeah. And what that does is it lets the retirement benefit grow. And often by age 70, that retirement benefit's quite large. Now, some people, it's a personal choice. Some people may want the retirement benefit earlier. But that provision allows individuals to receive a Social Security benefit, a widow benefit, while it lets the other benefit grow. And on average, that actually is advantageous. Mm-hmm. But Social Security is supposed to explain those options to widows and document that they've explained it to the widows so that the widows are fully informed. They get to make a choice. And what the Inspector General found was that Social Security wasn't doing that. And so, again, it's a personal choice, but Social Security is supposed to inform that choice by telling individuals, here's how your benefits work. You can claim one and wait for another. And it's up to you, but you should know what your options are. And so the Inspector General said SSA's staff are just not explaining that provision. Interestingly enough, in the SWIFT Act, which tells you they thought about a lot of these issues, that legislation formally requires SSA to deliver booklet or other documentation to widows explaining their options. So one of the interesting things about the SWIFT Act is not only does it do a lot of big policy, it kind of knows that a lot of people aren't even getting information that they need to make a good decision.
Well, I'm thinking Taylor Swift is from New York, so I'm thinking maybe we get her involved to get in this campaign to be able to talk about the SWIFT Act that is going to help millions of widows. This would be a great PR.
I agree. That would probably get some attention.
Right? Then everyone would know, because what I have found is the next generation of women who become widowed are the biggest advocates for us. It's the daughters generation that is like, I do not like how my mom is, or my grandmother is being treated. And so it is the younger generation that does need this type of awareness and advocacy so they can step forward for their mothers and their aunts and their sisters and their friends. Because the average age of a widow in this country is 59. Interestingly, and you know this information, but interestingly enough, I actually looked up the average age of someone in Congress. And the Senate is a little bit younger. I think they're 56, but the House is like 64. So
Hmm.
this average age of widows is the same age of the people who are deciding on this legislation. And so maybe the time is right, to have this conversation, because it's more and more people, as the baby boomers are aging out. We know that we're seeing we saw an increase in widows during the pandemic. We didn't really talk about it. Maybe that was
Right.
some impetus in her doing this.
Hmm.
I don't know. When we meet, I will ask her, which I don't know when that's going to be, but I have hopes. So the Social Security Advisory Board, what are they recommending in being able to improve this for widows and children? The communication at the uh, Social Security, now that the Inspector General knows that there's been a misuse of the money being and information being given to widows specifically, which they could have seriously, you know, needed.
Right. So, yeah, benefits are often the difference between living okay and having real hardship. Um, the advisory board is another organization in Washington. It's an official organization. It's bipartisan, so it's got Democrats and Republicans. And so any report that comes from the advisory board is bipartisan. One of the things they found was that often individuals are unaware of benefits that they're eligible for. And in
Mhm.
particular, they found that was true for surviving children. And so what happens is sometimes individuals don't realize what benefits Social Security provides. Um, and some of the things we talked about at the NACG conference last time
Mhm.
we got together was that something like 45% of eligible um, survivor children are not receiving Social Security, even though they should. So there's sort
Right.
of information gaps. It's kind of powerful. Like, that's not a question of changing the law. That's a question of paying benefits they should be getting. So a couple of things. The
Well, let me
advisory.
stop right there for just a second. Who is
Sure.
supposed to tell widows?
What's that?
Who is supposed to tell widows that they get benefits?
That's a good question. So one of the things the advisory board recommended was to restart the Social Security statements. So you may remember that in the past, you would get something in your mail from Social Security that would
Mhm.
tell you what you'd earned, but it would also tell you about the different types of benefits that Social Security paid, including survivor benefits. And Social Security stopped mailing that to American households.
Why?
And one of the things the advisory board says, the Social Security Administration should consider doing that again, because that's the most basic thing you could do. People are paying into the system, and tell them what the benefits are.
Right.
There are other things that the advisory board mentioned that could help. So it'd be good for the government and organizations to partner with individuals who deal with bereavement issues on a regular basis. So often
Mhm.
funeral directors or their workers are dealing with families at the time of the death. So actually, one simple thing would be to see if funeral directors would hand out even little cards that have Social Security's number on it and tell the basic benefits. Very simple things like that can make a difference. But I think one general theme was the advisory board was asking the Social Security Administration and Congress and others to think more about outreach, how you talk to people and make them aware of Social Security benefits. And then also for both widows and children, the advisory board was saying make it easier to apply for benefits. Um, people have different choices or preferences, I should say. Some people like to talk to a Social Security representative in person. Some people like to file online. Some people
Yeah.
like to talk on the phone. People are different. But the interesting thing about survivor benefits is you can't file online. All other types of Social Security
Right.
benefits you can. And so that's a service delivery channel that it's a little surprising Social Security doesn't offer. Not that
Yeah.
everybody would want that one. Some would want to go into a field office and some so forth. But there's been, I'd say, less investment in on the service end for survivors, like helping them apply for benefits and so forth. And the advisory board was raising that issue as well.
Yeah. And I'm so happy, right? Because I've always had this question. Why is it so hard to, when you die, you're going to go to somewhere to be cremated or
Right.
to officially record the death. Um, so where's the break and where's the difficulty? And Dignity Memorial SEI is the largest funeral home, and it's even difficult for us as a widows organization to get them to partner with us so that more widows, millions of widows that are in their database, would know about our resources.
Oh, how
No
interesting.
different than Social Security benefits, because these are family stabilizers.
Oh, sure. It's such
And
a difficult time and to have to worry about all the things related to grief, but then also the things about finance. It's just overwhelming. I agree that I think the funeral industry could do a lot of good with some simple things.
and when you're saying simple, it is pretty simple. It is literally, there is an exit package that they give you. I'm a Dignity Memorial client.
Okay.
I have done my end of life planning with them. I have gone to Houston. I have met with them. I have asked for these type of simple choices to be made by leaders of that corporation. It is extremely hard. And something so simple is so hard to get done. And I don't get an answer for why it can't happen.
Well, I
So
definitely applaud those
federal,
efforts because,
federal government, and we have a corporate industry that is not doing right by widows. Let's be real. This is what the advisory board is advising, and
yeah,
the inspector general has decided, and this new SWIFT bill is ringing alarms for. Honestly, I think in the SWIFT bill, it needs to say that there needs to be an definitive way to notify them. And somewhere when a person dies, it needs to be within a time frame within that first month. What does that take? Who's in the hands of those who are in that industry?
well, I definitely think that makes a lot of sense. And what I like about that is just how practical it is. I mean, you're not asking anything but some simple efforts that would make a huge difference in people's lives. I mean, so I definitely applaud that effort. I think you're on the right track there, though. The issue is who sees families when they're grieving. Often it's people in the
Right.
funeral industry.
That's right.
Let's bring them in to help. I think that makes a lot of sense.
That's right. And I think that when you really talk to people who work in the grieving industry, they truly want to find solutions. They do not like to see people suffering. And this is where the advocacy comes in a that's why in 2024 we also became Modern Widows Club, who serves widows, but also the Movement for Widow Care. The Movement for Widow Care are these types of conversations. How do we get involved in actually helping the future generations of widows and grieving families to get the real support that they need? There's the medical and the financial and the legal and the mental health. There's all these industries that kind of intersect with this, but there's no industry more than the funeral
Right.
services industry that is connected here. So I hope in the future that some advocacy will advance that. I do think that one of the things that we did as an organization is on our widow empowerment quiz, which we've had 8,000 women take part in. We asked the question: Do you have children, and have you applied for Social Security benefits?
Oh,
So if someone tells us that they have kids and they have not gotten information, we make sure that they learn that they can where to go. And
What a
so
terrific
that's
thing.
right, like such a
Oh my
small
gosh. I love
and
it.
they're coming to us to find out where they are in the hope, heal, grow, lead, what we call the healthy widowhood pathway.
Right.
But in doing that, we ask some simple questions, and it's elective. They don't have to tell us if they don't want to, but it's this moment where we can say, wait, if they have kids and they haven't applied, then we need to be that person to step in and say, hey, this might be something you might want to consider. We have had widows who have discovered that they are supposed to be getting benefits, and that is so. This is what advocacy is all about. You
Wow, that is
create
that's
systems that
terrific service to those people. That's awesome, Carol.
right.
Oh
So
man.
I love having this conversation because we see what we can do on our end, and we can all do something to be a part of, especially this bill, but also looking at our own industry, in our case, nonprofit, and how can we better serve who we're serving today and tomorrow. So, when you're dealing with the Social Security Administration in general, what should you literally say widows should look out for? Like, give us some real
Right.
practical takeaways here.
So I think there are a couple things. One is so Social Security has lost some staff. And so it is a little bit of a stressed agency. So maybe just uh, be aware of that. So prepare yourself that it may not be completely smooth. You need to think about the longer issue. Stick with it. Don't give up just because it's hard to deal with Social Security. A couple things, particularly for aged widows, which is the biggest group. Make sure somebody tells you about your claiming options and what your choices are. Um, that seems to be a big issue and a big problem, but that is their job to tell you what your claiming options are. So I'd say that's one of the big things to talk about. The other thing I'd mention is not everybody knows this, but many people do. But if you're not getting good service or your case isn't being processed or something's going wrong, call your member of Congress or your senator. So
Mm.
there's a toll-free number, the Capitol Switchboard. All you have to do is call it, and they'll connect you to either your congressman's office or your senator's office. Each member of Congress and each senator has caseworkers, and those caseworkers are typically in the home state. And so if you're calling and you say, I'm having trouble getting my benefits from Social Security, or they're not giving me good information, or it's taking forever, your senator's office should put the caseworker on that, and they'll work with you to help resolve the issue. And they'll contact the Social Security Administration. So there's that old phrase maybe from back in the day in America, well, call your congressman. That actually is good advice. If you're not getting good service or something's gone wrong, let your member of Congress help.
Well, you know what? That's really interesting because I have been in Senator Rick Scott's office multiple times, and they've even come to our fundraisers, and not one time had they ever told me that there are caseworkers for ladies who are having struggles with Social Security.
Yeah, there should be casework. There will be caseworkers in the home state, and they
Well,
absolutely will
guess
help.
who I'll be calling? Thank you for telling us that. I did not know that. And, I have interfaced. I went to DC in 2022 and spoke to about um, 10, both senators and House members. And honestly, they were clueless to what widows needed. They really didn't even know where we fit. They didn't know if we were in Department of Health and Human Services or Veteran Affairs or DCF, or like, where do we fit? And sort of the answer was everywhere.
That's true.
Um,
That's true.
and I think but one of the things that we were asking for is, how do we get a National Widows Day? We do not have one, and so we wanted to piggyback onto International Widows Day, which is through the United Nations on June 23rd. That has been around since 2010. but we have not seen any movement in a national recognition. The only national recognition most widows get in this country are military or first responders, but the majority are civilian widows, and they do not have a day, and they do not have a day where we can talk about the challenges that they're facing, and a lot of it has to do with these issues that we're talking about. Um, One of the other things I wanted to know if you know about some new legislator about bringing up to date the lump sum death benefit from $255 to, I heard someone has proposed for that to be inflation uh, brought up to speed to $2,800. Have you heard that?
I have heard that. And so the lump sum death payment, it used to be an amount that would help individuals who are dealing with some of the expenses related to death, like funeral expenses and so forth. And it used to be way back in the day an amount that really would do that. And then Congress capped it at $255, which isn't much these days.
Well,
Um,
let me just say, back in the day, we're talking 70 years ago.
yeah, it was some time ago. And so, yeah, so there have been legislative proposals to, yeah, and you could adjust it for inflation. I mean, that's a logical thing. Um,
Wow.
that makes we adjust monthly benefits under Social Security for inflation. It's very logical. The other thing that I think it would do is it would improve service in the sense that if you had a more viable benefit amount that people knew about and talked about, that will bring them into the Social Security office. And once they're
Mhm.
in, they will learn about other benefits. So it's not just that it helps with bereavement expenses, it helps with getting people to know about Social Security's widow programs. And I just think if it were at a higher amount, it would also serve that practical purpose. People would come in and ask about it, and then they learn about other benefits from Social Security.
Well, and why are they not receiving this letter when they receive that $255 check?
Yes, right. It's one of those things where it helps in a substantive sense, but it also allows you to do more outreach to widows. I think in a lot of
Yeah.
ways.
Honestly, I will tell you the $255 feels like an insult, and most women, it creates more confusion. They don't understand why they're receiving this. And honestly, it's not a clarity moment or a moment to get someone to come into Social Security. It is like, what the F is this? And
Yeah, and
what
it's
is
also
$255
if it
going to
were
do
set
for
at
me?
a reasonable amount, it's the most general benefit available to widows.
Yes, right.
Um,
Everyone
Even if you
receives
don't
it.
have children, doesn't matter your age, it's the most general benefit. And so what you have, I have heard people, widows who say don't have children, and they find out like, well, what we paid all those taxes and I get a 200. It's like this total disconnect. And so it might improve just some of the equity issues as well because it's a very general benefit. And if it were
Right.
paid at a higher level, it'd get
It
more
was one of the
attention.
topics that we talked about in when we went to DC and we had the International Widows Day Forum. We had a couple of CFPs on that panel, widowers, military, and they talked about this has to change. And so there is someone, and I can't remember, I was trying to find out the name. Because I'm going to be writing an article about this in Widow Life. I am researching this, and this podcast is part of really researching how we can all get behind this SWIFT Act and what else can we do, right? There needs to be companioning actions, proactive, and we also need not just widows, but family members of widows to help us. It can't just rest on the responsibility of the widows themselves because they're already handling so much in their life, whether it's with children or without children or disabilities or without they're managing so much. And so anything we can do to get them more awareness and education quicker, the better. What does research that tell us how widows are faring today?
Yeah, this is an active area, and it's really one reason I think people get interested in Social Security and widow benefits. It's because
Mhm.
most studies of widows focus on issues around what I'd call economic well-being or poverty. How are they faring in terms of money or economics? And so what you see is that some groups of widows, for example, widowed mothers, not all, I mean, there's a lot of variation, but the poverty rates for widowed mothers are very high relative to other Social Security beneficiaries. They struggle. Not
Yes.
everybody, but many. The poverty rates for disabled widows are extremely high. Maybe a third or more of disabled widows have income below the federal poverty line, which is pretty low, maybe $16,000. So a third of the widows have income below that. That's kind of startling in a way. Um, and then for aged widows, what you've seen is that because of Social Security, poverty rates have come down from their really, really high levels in the 40s and 50s. But even today, aged widows have modest income relative to other Social Security beneficiaries. So, what research shows, based on studies using federal data and others, is that this group has often has modest or low income. Again, not everybody, but many do have modest or low income. And so that research, I think, lends itself to why these bills should at least be looked at. I mean, they're dealing with a real world issue, which is that many widows don't have sufficient income to either maintain their standard of living after a spouse passes away, or they have very low income, perhaps below the poverty level.
Yeah. And we're seeing that in the US Census Bureau, 50% of the 11.6 million widows in this country are living in poverty. So some are mothers, some are not. So we always say widowhood is a ticket to poverty for a large majority of women. And in the care of those women are many children who are going
Mm-hmm.
to also become they're going to experience the ACEs, right? One of our board members used to do work in prisons, and he said one of the main existing reasons why men end up in prison is because they don't have their father, and they had a mother who just lost control of the family stability. It's also the number one feeder into the foster care system,
Right.
in the orphan care. We are not stabilizing widowed. Specifically, there's more widowed women than there are than men. We know that, and those women are not getting the support that they need. We as a nonprofit fight very hard for grants because we keep our program costs down as low as possible. But it is almost impossible to find a foundation or grants that even care or even know the needs that widowed women are, it just need to have readily available. And it's really something that we've exposed here at Modern Widows Club with just, over like 60,000 women in our community. We know the real issues that are happening. We also know the issues that are happening worldwide. And we do know that the world is watching this country. They want to know what we're going to do about the real problem because of our power and because of our wealth and our ability to actually step forward for this vulnerable population. Because when it happens here, then they can use that as an example in other countries. But we have to do it here first. That was one of the things that I realized when I went to DC is that, wow, no one is accepting real responsibility for caring for this demographic. There is no widows caucus. There is no
Mm-hmm.
widows division of the women's caucus. There's no one representing or lobbying for them. So I am so grateful for this SWIFT act and every person that's sponsoring it and will come to sponsor it because it is a real chance for us to make some real change. And you're right here with us, David.
Well, thank you so much.
So, any takeaways, just from this conversation? I mean, my eyes have been open, and honestly, I'm grateful to have you as an advocate with us. Your body of knowledge and expertise is needed to help steer us in really getting this off the ground and getting more action.
Yeah, it was. it's been a treat to talk to you. I've learned a lot just reading your material and also your posts on LinkedIn. I think this idea that it's interesting because it's a large group. You know, widows are a large group. They're potentially very influential. And so they can, like your efforts to organize them for public policy and other things, kind of fills a gap. That's something that's exciting. But also, like you're saying, it's hard for, you got to think through how you build the infrastructure and support. And so some of the reports I saw you've released, I really found interesting. Like you kind of did a survey of all the nonprofits across the country and showed that maybe more needs to be done for supporting some of the nonprofits in the different states. I thought that was really very interesting. But I like this idea. There's this very important group, and it's a group that a lot of people do care about. Like you're saying, even if you're not a widow, maybe you're worried about your parent or somebody else. And so it is a potentially powerful force if you can kind of make connections like you're doing. So I found that kind of eye-opening.
I think that every family experiences some level of widowhood, whether it's a grandparent or a parent or a sister and so it's probably one of the most common women's health issues that is super invisible in a lot of ways. And I think
Mm-hmm.
I was surprised by that over the last 25 years of searching for where we belong. Where are we elevated? We do it for domestic violence. We do it for female trafficking. We do it for a lot of reasons. But what's not happening is we're not believing all of these widowed women who are saying $255 isn't going to help. Benefits
Right.
stopping at 16 are causing more challenges for me. We weren't believing the women when they were sharing this. And I think now we're getting more of a collective. And that's why voting is so important. And when I discovered with the Center of American Women in Politics at Rutgers University that widowers, 3 million widowers, the guys were outvoting 11 million widows. And it's the number one category where there's predominantly more women. This is the reality. And then when you're married, it's almost nose to nose. So what happens to women when they go from being married to being widowed and they stop voting? That's
Mm.
the most important time to be voting.
Yeah, that's a really interesting observation.
Yeah.
That's something I would have necessarily thought of.
So I'm known for one of my strengths is reading, connecting dots that don't look like they're supposed to be connected, but they are, and underlying that. So I think that's the reason why we met. I stood up in the audience, and you were talking about children's benefits, and I was like, "What about the parents?"
Right.
And that was the moment we first knew each other, was this brave moment where I stood up at a conference for children and stood up for the parents who are the ones that are driving those children to those grief centers. And so it is critical to care for them as well. And we're here to help create that, go from crisis response to comprehensive family care. And that's what I'm going to be talking on at NACG this year.
Oh, that sounds
So
great.
yeah. So thank you so much for being on the Healthy Widow, Healthy Woman podcast. And we'll put in the show notes all the links, but I would follow David on LinkedIn. And his posts are really deep and they're enlightening. And you're here to advocate with me. So thank you so much for spending all this time and raising awareness along with us.
Well, thank you for having me, Carolyn. I really enjoyed it.
Thank you. You can learn more about Modern Widows Club, the movement for widow care, at modernwidowsclub.org, and take a listen to some of our other podcasts. And we'll see you next time.